Hi, we're the Midwest Implant Institute clinical team, and we're going to show you what we do in the office to create a sterile field when we're doing larger grafting procedures, sinus elevations, or multiple implant procedures. What I'm going to do first is I'm going to get my glasses on and my cap and mask and some gloves, and we're going to wipe down all the surfaces here. You can use any approved surface disinfectant here. They actually recommend that you do not use aerosol even though you're wearing a mask because of inhaling all the fun fumes. Now, sterile field is from shoulders to waist. Obviously in the dental office these hoses go below our waist, but we're wiping everything down anyway because we want this as clean as we could possibly get it. I would have to agree with them on the fumes because even with these being wipes, it's very, very strong. Okay, and I'm going to wipe down our X-ray unit. Now you're probably wondering, why am I not doing up there? Well, number one, I can't reach up there, and that's completely out of the sterile field. I'll wipe down our sensor. Stand, wipe down our counter surface over here. Now you will have to be careful with your implant motors. Some of them you cannot use these on. You'll just have to contact your distributor and see, especially if it's a touch screen. Then our light handles here, because it will do nasty things to it. And last thing we'll do is our chair. Okay, now I'm going to get rid of that and I'm going to get some new gloves on, and we're going to start bringing all of our instrumentation and our drapes in. Okay, this is our sterile drape. We have an extra large gown and our gloves. Now this tray I'm just utilizing to carry everything in. We have our surgical instruments. Handpiece, suction hose, PRF box, implant kit, stitcher handpiece, bite block, spurs, blades, and we will get our tubing for our handpiece, our implant handpiece, and get that out. Okay, we're going to get rid of this tray. First thing we do, again, only touching the outside. This is the pack that Dr. Keller and his staff created many years ago. Has everything in there that we could need other than our gloves and the extra large gown and anesthetic. And it's got a little cheat sheet. Peel here. Not hard to follow. We open this up like so. Now normally I would be standing in front of this, but you wouldn't be able to see what I was doing, so I'm doing this way. Open up like so, and like so, keeping your hands on the outside. Now, I'm going to take the suction, peel it open, and again, we're going to use this as our sterile field to open up all of our instrumentation and gloves on. Now, the reason I'm using the chair is this is going to be all busy with being sterile, so I need this non-sterile surface to be able to open things up on to transfer it to the working sterile surface. And again, we just toss everything on the floor. Not touching the inside. If you worry about being super neat when you're setting up, you're not using your time efficiently. It's easier to toss stuff on the floor and then go up and pick it up real quick after you're done setting up. These full drapes, when you first start doing them, they're going to take you a little while because there are quite a few more steps to everything than the half drape. Okay. Open up a tubing. Some of these things can also be tricky just with exam gloves on. Like so. That part right here that fell, we don't use this, so it doesn't matter. Okay. Dental hand piece. Our suture. Curved and a straight blade. We created this little burr block because we used to just put individual burrs and try to guess what we're going to use. We've got every burr that we could ever imagine we would need that will fit in that burr block in there, and it's really helped us out a ton. Doctor's gloves. First assistant, second assistant, and this will be for setting up, and extra large gown. Now in another room here we have a Insta-Hot that we can run our anesthetic, our barriers, and whatnot under, the stuff that we can't sterilize. So I'm going to go out and do that real quick. Okay, so we're going to take our items that we can't heat sterilize, and we're going to run these under the 190-degree water. About 30 seconds is all you need. A little different with the full drape because the light handle covers and the x-ray cover is included in the pack. There we go. And we're ready to get these gloves off, start setting up. Normally, when we are setting up, because we're usually doing multiple setups at one time, there's only one of us to take care of this. You don't really have a non-sterile person. So I'm going to show you a couple of tricks. When you put your gloves on, number one, you want to make sure you don't touch your skin. I'm going to show you a couple of tricks that you could utilize if you need to, say you forgot something, that you could still remain sterile and be able to still deal with getting a an item and open it up. So the first thing we're going to do is save this. We're going to put it over here. And then we're going to take our drape, touching it from the top because the bottom is not sterile, okay? And we're going to get it situated on our operative surface, like so. This piece of foam gets thrown away. It's useless. It's just a wrap. Then we're going to start emptying our tray here. We have a large gown with a towel. Towel goes on top of the gown, and then the gloves go underneath. So we're going to come back here and we're going to get this all situated. The doctor's the last to come in, so his gown goes last. His or her, I'm sorry. So we're going to unwrap this because it comes in its own wrap. So it's gloves, gown, towel. You scrub, you dry, you gown, you glove. We'll show you that here in a minute. The same thing here. Second assistant in and third assistant in. Now we end up having an extra gown in here because we do add the extra large gown. We just save this off to the side in case for whatever reason we need it. You never know what could happen. Okay, these are our drapes that we're going to cover our instruments with. This is our Mayo stand cover. I'm going to show you what to do with that in just a moment. We're going to put it over here so it's out of the way. In this pan, we have some 2x2s, some wraps for some tubing for our handpiece, and there's also a extra straight and curved blade. When we do these procedures, many times we need multiple blades, so we always add a second in. We could still use these even if we don't use them during this procedure. We have a couple of 20cc syringes. We have a 30 gauge needle. And for the time when we use betadine, we have betadine swabs in here. Hardly ever use those. These are overgloves that we're going to use here in a minute when we prepare our patient. We're going to cover this with this sterile cover, and we're going to set it right there for when we need it. We have 2 sets of light handle covers. Our old surgery suite had 2 lights, so we needed these. We decided to keep them in the kit because they come in handy, and again I'll show you why they come in handy. We put one set over on the side with the implant motor, and then the other side over here so we can use them for our light handles. This is our x-ray cover. That I put on last because we want our instrumentation to be the most sterile. This is our split sheet. This is to hold our water. And we even have a little trash bag, which has adhesive on it. And you can place right there. Okay, this you don't need. It's just a lid for that cup. Serves no purpose. So we're going to grab our instruments like so. We have our 2x2s. We're going to put those in there. This would serve as a purpose for if you're doing a bone grafting procedure for mixing your bone. We also use the Dappen dish for that, but that's for smaller procedures. We have sterile gauze that we put in sterile water, and then we also keep some dry ones for various reasons. One being we might have a patient with itchy nose syndrome and we're scratching the nose every 5 minutes, or we might need to push glasses up. There are varied things that we use that for. Always trying to keep in mind we're trying to maintain a sterile field. So obviously if your glasses are falling down, you don't want to push them with a wet gauze because you're going to have wet glasses and create a whole another series of problems. So we do have a way that we have chosen to set this tray up. And it's basically in the order that we use the instrument. There isn't a right way or a wrong way. This is just what works best for us. I'm going to get everything out of this cassette first. Get this out of the way. And we just set this up in the way that we use. We have our mirrors. We go local and we make an incision. Then we do our reflecting. We have all of our reflecting instruments here. We have a Woodson 1, we have a 14, we have 2 number 9s. We have a small Selden, a large Selden. And we put a couple of things up here at the top that are our doctor's go-tos. That way he knows exactly where they are, and if the words aren't coming out to ask for them, he just reaches for them. Because as you know, when you start concentrating, sometimes the words don't flow just the way you want to because you're concentrating so hard on what you're doing. That's our job as assistants, to know what you want when you don't know what you want. Alrighty. So we're going to put one section here, we're going to put one section over there as an extra. This is instrumentation that's going to go over on the motor side. This is for this assistant over here. So we're going to set this part up first, then we're going to come back over there. Now I need to grab my suction hose from here. And that's one downfall of putting in a chair. Sometimes things roll, but it's on a sterile surface, so it doesn't really matter. And we'll put this back together like it goes. And by the way, if you don't have a PRF box, you really need to get one that really, or if you're not doing PRP and PRF, it's quite fabulous. It does amazing things for your patients. Door block, suture, bite blocks, hand piece on there. Okay, we're going to attach our suction. Suction hose on here. And in a moment, I'm going to slip out and get the anesthetic and the needles from the tray that we ran into the water to sterilize them, which I'm going to do right now. We decide how much anesthetic we're going to get out and what type by what the patient dictates. If they need special anesthetic, we'll get that out. Depending on the case, we'll get anywhere from 3 to 4 to 8 lidocaine, and usually at least 3 articaine just in case. And then we'll add in anything else that we feel we need during the procedure, whether we need some 1 to 50. And many times with these large cases, we will give Marcaine at the end of the procedure just to keep them comfortable, because many of our patients come from several hours away and they might not be able to get a pain pill in them for some time. So that just helps keep them comfortable. Put on our needles, we'll load our anesthetic. Like so. Then we're going to grab our split sheet. I'll lay that on top of here. And then come our drapes. First drape lays across here. This one goes under the patient's chin. You'll see here in a second that it recreates what the 1033 drape does, only in a little larger fashion. And the second drape, actually the first drape to go on the patient, this goes on their eyes, so you don't want the sticky stuff on their eyes, so you're going to turn this one down. Okay? So, we've got that all set. Now we need to deal with our Mayo stand. I'm going to pull this a little closer to me. Like so. This is like a mouth. Like that, okay? Slide this on. You don't want this to hang down and touch the floor, because then guess what? It's not sterile. So to keep your hand on it, so. Look at that, perfecto. So we're gonna take our PRF box, we're gonna put that on here. We're gonna take our instrumentation for this side of the chair, which is one of our Selvins. These aren't really utilized in this drape. This is to stabilize it, but it's in our kit, so we just put it over here in case we need it for whatever. We're gonna get rid of that, that's no longer needed. We're going to put our extra set of light handle covers on here, and we're going to open up this, so we're ready to do that. Okay, so now what I want to do here is I want to take our other drape and we're just going to lay it over top of here like so, and then that's all set. If we were going to be doing a procedure, like I said, we do have sterile water coming through our hand pieces. If we were going to do a procedure which we were going to require external irrigation for some reason, we would load these with sterile water, and we have a sterile blunt needle that we keep in here as well. But those would go over here on this side. So, I'm going to go ahead and get our implant motor. We always wrap our handpiece in a CSR wrap before we put it in the bag, and the reason we do that is, number one, it's very hard to get in there. Number two, we have an extra sterile surface. So I'm going to go ahead and attach this here like so. I'm going to wrap that up like that. We have our irrigation tubing. I'm going to open that up, toss that back there. Now this portion is non-sterile. There's no way you can make that sterile. So what I have to do is attach this here, attach this here, and this is just going to kind of hang out here until I'm non-sterile and I can carefully reach underneath there and attach all that. Then we're going to cover this with our extra sterile CSR wrap. Okay. Oh goodness, I forgot to put sterile water in there. That's what I saved this for. I did that on purpose. Inside of here is sterile. That's where your gloves were. You can tear that apart. Grab your sterile water. Unscrew it. Use your sterile hand. Lift this up and pour that into your cup. Of course, be careful not to touch anything with your bottle. Okay, so now we have our stuff sterile that we want the most sterile. So the last thing that we do, other than get rid of our trash, is we wrap our hand pieces that we're going to be using here, and then we put our barriers on our x-ray unit. So these can be very, very tricky if you're not used to using them. It's got adhesive all over the place here, and it's really, really long. So what you want to do, again, down there is sterile. So you're going to kind of bunch this up, like so. Slide that over your handpiece. Extend this all the way down. Now, I guarantee you, if you wrap this up here, you're going to have a very unhappy dentist. You want to wrap this down here where they don't have to mess with this wrap. And again, it's very technique sensitive. You're going to have to do this 30 or 40 times before it looks as easy as what I'm going to make it look. I've probably done this, gosh, 10,000 times. That I just made that look really easy. It's not that easy. We're going to set this up here for right now. We're going to grab another one of these. And again, there are varied procedures where we might use our slow speed as well, so I'm going to go ahead and wrap that. we're doing anything with bone screws, we'll be using that. Or if we're going to be using a two-post burr to level off some bone, we'll be using this. I don't have a hand piece on here, but I'm going to go ahead and wrap this just to show you again how I did that. Let's keep one finger, wrap it around. And this is all sticky. This entire thing that I pulled the tabs off is sticky. I'm gonna lay that up there, and you're asking, why am I laying up there? That up there. Well, here's why. I wiped this off, but it's disinfected at this point. It's not sterile. This makes it sterile. So I'm gonna go ahead and tear part of that off. And yes, you can argue that's below waist level, but again, we want this the best it could be for our patient in the dental office. So this makes it best. And we just put these back into our holders there. And now we're going to put on our X-ray cover. A little bit easier than the other one. And I'm going to go get our sensor wrap. And as you can see, this could be hard to get on, so I'm going to go ahead and take my glove off. I'm going to go ahead and feed this into here like this. And it can be a challenge, but it can be done. You have your extra wraps here. You can just put, just in case you need them. Don't throw anything away until you're done with the procedure. Put them over here. Now we're ready to clean up and bring our patient back and get our drape done. Okay, so now that I'm non-sterile, I can go ahead and insert the tubing into the sterile water. And you'll want to make sure that this is cranked down so you don't have water everywhere. Thread that through. Okay, we're good to bring our patient back and get draping. Alrighty, we've got our patient in the chair. We've already confirmed medical history. At this point, we would be doing our local anesthesia or IV sedation and our blood draw for our PRP and PRF. And we're going to have her just relax here for a few moments, and now we're going to get scrubbed for our full drape. Okay, so I'm going to be scrubbing with a 4% chlorhexidine solution. I am not allergic, but this is what you would use if you do have somebody that is allergic to the betadine. So we're going to peel this open. We've got a little scrub brush and a little thing to clean under your nails with. I'm going to turn the water on, get this nice and soapy. I'm going to clean my nails. If you don't have fingernails, which some people don't, you don't have to do this because it will hurt if you try to clean under fingernails that you don't have. Be real thorough here. I want this to be as clean as we can be. Throw that away. Nice and soapy. I like the brush because I feel like it does a good job. Standard rule, 10 times. 10 times like this is not 10 times. 10 times. And go from hand to hand. And we go up 1/4 inch below, or an inch below the elbow. Toss that in the sink. One-way rinse. We don't rinse and do this. One time through, drip to the elbow, as many times as you need to get the soap off. Now we drip dry and we go get our towel. We shake our towel out. We pat, we don't rub. Using one side for one arm and hand, the other side for the other arm and hand. You want to make sure you get really dry or else you won't be able to get your gloves on very easily. We just toss that on the floor. We go to give our gown. Our gown is like a book. It's got letters on it. It's got a little place for our hands. We just open this up. And as I said earlier, up there is not sterile, down there is not sterile. You go straight out in front of you. Then a non-sterile person is going to come up behind me and is going to attach the back of my gown. And you keep your hands inside to make these little sock puppets, okay? I have my gloves here. I'm going to open these up. Here's the thumb. Here's the letters. You're going to put the thumb on your thumb with the fingers pointing up toward your elbow. You're grabbing a hold of the beaded cuff. You're going to grab it with your other hand here and you're just going to flip these over like that. Same thing on this hand. Reach in. There's the thumb. There's the letters. Grab with that. Flip it over. Get all situated, you got your gloves on. Now, this is a little cheat sheet. It says assistant grasp here. So you're going to grab the white part, grab the short string, pull this apart. You'll hand this to a non-sterile person. Turn yourself around. The non-sterile person holds on tight, you hold on tight, you pull, and you tie. Now we're going to do that 2 more times with our second assistant and with our doctor. Then we're going to get to draping. behind you. We're going to take this towel, we're going to shake it out. He's going to do the same thing, hand to hand patting. And you want to get your hands really, really dry because it's very, very difficult to get your gloves on. We've got our extra large. Obviously Dr. Heller's a little bit taller than we are. Letters go toward him. Again, we've got our little book here. We're going to open this up, shake it out. I put my hands on the shoulders. We basically just do a bear hug here, okay? And if your doctor wears a light, look away. We do the right hand first. This is very important. You don't do this. You do this. The thumb is toward him. Get his hand right in there. And now that he's got a gloved hand, he can help out with this one, like so. Okay, so here's another one of those predicaments. We don't have a non-sterile person. The back is not sterile. So guess what I have to do? That extra set of light handle covers, that's what I'm going to tie him with. And some can argue, well, the gown's sterile, why can't you? The back is not considered sterile field. So, after you've done this 27 years like I have, you get pretty good with stuff on your hands. We tie the inside. Get rid of our covers here, because I can come around and I can go ahead and do this. He'll hand that to me, do the hokey pokey, turn himself around, tie himself up. We're ready to do some surgery. Okay, so I'm going to put on our overgloves. And then we are going to use our chlorhexidine for our patient. Now, as I showed earlier, this is what we used to use. This is the betadine. If you choose to use that, you can. We found that there are so many things that make this better. Mostly the itchy nose syndrome that people get. They get that enough. Now, as I stated earlier, we would have given our local anesthetic, started our IV, and done our blood draw previous to doing this. Okay, Kenzie, open big for me. We're going to do the inside of the cheeks, the outside of the teeth, same thing on the bottom, roof of the mouth. They usually love that a lot. Stick your tongue out for me. And Mr. Tongue there. Get rid of these. Same thing here. These don't need to be sopping wet. You just want them to go around the lips, underneath the chin, around the cheeks, over the nose. Anything that's going to be exposed with our drape, because we don't want to transfer any bacteria from her face into our mouth. Get rid of those. I'm going to get rid of these. First drape, folded down, no sticky stuff over the eyes. Okay. Second drape, sticky stuff exposed underneath the chin, wrapped around. Look familiar? Looks just like our 1033 drape with this part exposed. Split sheet. It's got a cheat sheet on here for you. It says split sheet. Arrow up toward the patient, words on the patient. Unfold, unfold. If you can read, you can do this. Now, here's the tricky part. When you're unfolding this, you keep your hand on top. You keep a hold up here, because if you start going crazy, you could slide it all the way down to where her non-sterile surface is exposed. You always want to keep your hand up here, okay? Now, we have adhesive strips that need to be pulled. That one goes off that way. This one goes off this way. Take one hand. Now, we normally don't have two people in here to do this. One hand right here. over and around, over and around. Okay. Now we have in our office a lot of snakes down here at the bottom. We have a lot of different rheostats we use. So we take this and tie this up so that the doctors can see what they're doing down there, because we have a lot of different instrumentation that we use that all have a different rheostat, and it can get very frustrating. Then we take our suction, and again, you let them know what you're doing. You're going to feel a little pressure on your chest. We have to lay a suction across you. Apologize for that. Then this is a little different than the half drape. We take a little bit of our drape here. Now there is a place up here for the suction. It's very difficult to use it that way, so we choose to do this way, okay? So we save our sterile wrap from our doctor's gloves. We're going to put this up here once again so that the mouse can be utilized during the procedure, okay? Now, we don't have our chairs in here just because there's not enough room to have the camera and everything to do the video. This goes on our assistant chair so that it becomes sterile. It wraps around the arm so that whoever is assisting can lean against that and still remain sterile. Last thing we're going to do, our headlight covers. No touchy. Wrap around. And of course we will save the ones that we use to tie doctor if in fact we would need to go out of the room and get something that's non-sterile and you can bring it into the field if we didn't have somebody else to do that for us. Now we're ready to do our surgery. Okay, with our final and last drape, this is the one that's covering the Mayo stand. We peel off our sticky. We wrap it on the arm of our assistant's chair, stick it underneath so you can get in here and you can lean and do your assisting and be comfortable. Okay, here are some things that you don't want to do. If you have an itch, don't do this. You can take a 2x2 if you have to and do that. Another thing you don't want to do, you don't want to do this. Again, if you have to, you can take a 2x2, push your glasses up, okay? Another thing, if you're in the full drape, you can utilize these to adjust your glasses, to adjust your chair, to when you're taking an x-ray, you want to grab the wrapped portion of the x-ray unit. You don't want to grab it where it's not wrapped. It's just common sense stuff. We want to keep this as clean and sterile for our patient as is possible so we don't have any post-operative infections.